I'm Julie Krellman, and I am 50 years old, and I had my vertical sleeve gastrectomy on September 21st, 2010. I have since lost 301 pounds, and I still consider myself in the losing phase because I'd still like to lose some more, but as time goes on, the losing process has slowed, and I'm okay with that. If it takes the rest of my life and I continue to lose a pound at a time, I'm okay with that. My husband was part of my journey. This is my husband, Rick Krellman, and he also was my partner when I was looking into this and I decided to have the surgery. And from the very beginning, I believe you were in agreement that this is something that I wanted to do. And you wanted this for me?
Yes, we both found this article in the magazine talking about this weight loss procedure, and I thought that it would be just perfect for what you would need.
Were you worried about sharing that article with me?
Oh, of course it is. That's a difficult thing to try and tell somebody and say, here's an article on weight loss. So you, honey, because you don't know how the other person's going to take this. They're going to go, well, what do you mean weight loss? And then you're stuck, right?
Sure.
So it's a hard thing to approach that subject.
Sure. And you had never really said anything to me. And I think maybe the one time that you did say something to me, I think I snapped a little on you, I think.
Because
I got a little sensitive.
That's what you expect people to say when you go, I think you're overweight and you got to do something about it.
Right.
So that's difficult.
Right. So when you realized that I was receptive to this, did you worry at all? Because my big concern when I first saw this was the cost. I just thought that, because I never looked into it before, and up until this article, I'd never even considered surgery as an alternative. Did you know anything about?
Had no idea what the cost was, and for me I didn't have any way to put a value on health.
Right.
So whatever the cost was going to be was immaterial to what you were going to get out of it and your health back.
Right. Rather
than spending money on a casket 5-10 years down the road in which to bury you, this is definitely the way to go.
Wow.
So it didn't matter to me what the cost was.
Yeah. So then we were both in agreement to do this. What were your concerns? I know I didn't care. I just wanted it, and it couldn't happen soon enough for me. Sometimes I think maybe that we really didn't stop and take the time and look into this a little more than we should have. I don't think that we were as educated as we should have been. I now know that I work for the company and that how important it is to do your research. Did any of that concern you? When you found out that this was in Mexico, did you worry about that?
Absolutely. The anxiety of, I knew that the office was in Saskatoon, so I thought that the surgery would be probably in Saskatoon. I found out it was Mexico. Of course, all the anxiety of, the back seat of a 65 Chevy Impala for the surgery and we just jumped in with both feet. And yeah, we could have certainly did more research. I mean, as it turns out, I think we hit the home run out of the park right up to that first thing.
Absolutely. I just think that as I do now with patients, we absolutely want them to look. We know that Dr. Pomp is the best. We know that we're an international center of excellence. But it's important for each patient individually to come to that and to understand that, you know, on their own. Okay, so let me ask you this. So I have the surgery and I start losing the weight. Were you convinced that I would lose the weight and I would keep it off? Or were you a little nervous that I would lose the weight and it would stay off for a year or two and then maybe I'd gain it back? Did you have
No,
some of that?
I was pretty sure that you were going to lose the weight. I remember asking the one time when you had got down to, I think it was your goal at 300 pounds. And my question was, you know, how much farther can you go? And I think the answer was, well, you know, if this is all I'm going to lose, then that's it. And I was going to myself, well, that's good, but I think there's more in this. And,
Sure.
and I'm sure,
Sure.
that you're going to do better than this.
Well, I think that's everyone's fear, is that we have that surgery and I'm going to be the one patient that it doesn't work for. I'm going to be the one person. I see the results. As somebody who hadn't had the surgery yet, I saw the other people and it worked for them. My big fear was it wasn't. Or all of a sudden I'd had the surgery and I was 6 months in and I hit a stall or I hit a pause and the scale didn't move for 4 weeks. I knew right then, you know, when you know, because you knew my frustration and you knew that, you know, you had to deal with it. So we get past that and we get past 300 and, you know, we're working, you know, our way down. And then I had my plastic surgery. Was that,
Well,
and I know that was, you know, another expense. And so.
Well, that's part and parcel of the whole package. I knew that this was coming and again, the money is well worth the result. I mean, now between you and I, we battle the scales to see who's, you know, we're now about the same weight, and now it's how much on the tomatoes today. You know, I was
We
this
go
much.
back and
You were
forth.
that.
So
Yeah, we battled.
did you have an issue when the food in the house changed?
No.
I mean, our eating out was different. The grocery shopping was different. I know you like the fact that we didn't spend the money on the groceries, but the meals that I would cook, I don't cook those meals anymore.
No,
I don't
and
do the
that's
desserts.
Fine for me. I thought that we could all, you know, who's the kid that there isn't a person out there that could lose 10 or 15 pounds. And I was quite willing to be able to, well, maybe I'll jump on the coattails here and maybe I can lose a few pounds. So.
True. I mean, it certainly has made our eating in the house much better. We don't bring anywhere near the junk in that we used to.
Absolutely.
Yeah. What have you noticed in me as far as myself, my confidence? I mean, I know what I see and what I feel, but you must have seen that.
Oh, it's the energy levels. Energy levels right through the roof. Something as simple as walking across, you know, a parking lot in the wintertime. You know, I used to kid you about being a mountain goat, but the mountain goat thing was, you know, and now
at 400 pounds, falling at 500 pounds on the ground, I was gonna hurt myself. So yeah, I was very trepidatious. Now I'm
confidence
spry.
level there to walk across the icy parking lot with me in stride. It's amazing. Up and down the stairs. It's all that.
I think, and this is personal, but I think it's made our relationship better.
Sure.
I think I feel more comfortable with you in every situation. I felt before like you were just this really nice guy who'd married this girl who'd gained all this weight, and you were just going to
go along for the ride.
Yeah, because what were you going to do, right? And you didn't. And you loved me at 500 pounds, regardless. And you love me with losing the weight. And I think
that's made me love and respect you all the more. And I think in doing that, I'm more comfortable with who I am. And so I think this has been a good thing for both of us.
Win-win.
Win-win. All right. So one more plastic surgery to go.
One?
Or two.
All right, you go, girl.
All right, I'm in. Thank you.